If you want to safely keep up some sort of exercise routine after breast cancer surgery, this video covers core exercises. You may be extra motivated to do some of these if you had low back pain after surgery like I did. I'll walk you through 4 exercises that can be done in the early stages, so 2 to 6 weeks after your breast cancer surgery. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. I had low back pain after my double mastectomy and then again after my reconstruction, so I implemented core exercises about 2 weeks after both surgeries. These movements can be done on the floor, but they can also be done if you're in the early stages after your surgery up on your bed. 3 out of the 4 exercises can also be done if you still have your drains in. The first exercise is a dead bug. There's a few variations to this exercise. You can start by lying on your back with your feet flat on the floor. Keeping your abdominals tight, you're going to slowly raise one leg up until your hip and knee are bent at 90 degrees, and then slowly lower down to the start position. Once this starts getting easy, the next progression is to start with both hips and knees bent at 90 degrees. Slowly lower one leg down while keeping the other leg stationary. Bring the leg back to the start position. Repeat with the other leg and then continue to alternate legs. You can do 5 to 10 repetitions per side. It's not necessary to lower your leg down all the way to the floor. This exercise is still effective if you're lowering halfway down. Some people will straighten their leg as they're lowering it down to the ground. There's no right or wrong to this, but it can be more comfortable for your back to keep your leg bent throughout this exercise rather than straightening it. The next progression is to add your arms. You'll slowly lower your opposite arm and leg down and then return to the starting position. Continue the number of repetitions by alternating sides. I had reconstruction with tissue expanders and then implants placed under the muscle, and I found that when my arms were in the air, I really felt my pecs activate, and it just felt really weird at those initial stages after surgery. I ended up waiting till about a month after both surgeries to add the arm component for this exercise, so I just did it legs only until that point. The next exercise is a glute bridge. You can start by lying on your back with your feet flat on the floor, hip width apart, and your arms are at your side. You're going to push your feet into the floor and raise your body up and squeeze your glutes at the same time. You can hold a few seconds at the top and then slowly lower down and then repeat. If this exercise gets too easy, you can place a circular band just above your knees. While you're doing the glute bridge, you can think of pushing out with your knees on the band while you're moving your hips up and down. You can do 10 to 20 repetitions depending on how challenging this exercise is. The third exercise is a side leg raise. This exercise is best to do once your drains are removed and you can much more comfortably lie on your side. You're going to set yourself up in a figure 4 position, where your bottom leg is bent and then your top leg is straight. Slowly raise your top leg up and then lower down. You can repeat for 10 to 15 repetitions. There's a tendency to move the leg forward during this exercise, so do your best to try to keep your leg in line with your body as you're moving it up and down. There's also a tendency to roll your leg back so that your toes would be pointing up towards the ceiling. Try to think about pointing your toes towards the floor and then instead leading with your heel as you raise your leg up. If you're new here, consider subscribing. I cover rehab and self-care tools after breast cancer surgery and treatment. The fourth exercise is hinging. This exercise is a great movement in general for our backs, but especially after breast cancer surgery. I find we're not moving around the same way we normally would, and we're also very limited in positions, especially in those early stages for resting and sleeping. So this adds up in the body. You can start by sliding your hands down your thighs. The key with this movement is to push your hips back as you hinge forward. This will activate your low back, glutes, and hamstrings. Try 10 to 15 repetitions for this exercise. You can also try using a broomstick at home where you would slide it down your thighs and then back up. The idea with this exercise is you want to try to incorporate it into your everyday movements. So for example, bending forwards or leaning down to pick something up. You want to try to do that with this hinge type of movement. You'll want to avoid rounding your back when you're doing this particular exercise, but also when you're doing those everyday movements when you're bending forward. During the initial stages after surgery, you'll likely be crouching down to pick things up, but you can give this a go once you feel comfortable. If you're past the 6-week mark after surgery and you want to progress some of these exercises, the next video covers just that. See you there.